knee is killing me. I can't go upstairs without pain, it hurts. Can you relate to this problem? If you have a knee problem, don't worry, there's a solution. And I want to start by saying there's a good chance it's not actually your knee. Maybe you've been told that you need a knee replacement, maybe you've been told you have the dreaded arthritis. But most of the time, knee pain is a functional problem. The knee is not working properly, it's not moving the way it should. And often it's secondary to an ankle problem or secondary to a hip problem or a lower back problem. So for example, if your hip joint doesn't move the way it's supposed to, then your knee is going to have to work harder. Same thing, if your ankle is not moving properly, then your knee has to work harder. So you're going to feel strain around the knee. But don't worry, you probably don't need surgery. You probably don't need a knee replacement. Those things are overprescribed. Maybe you don't even have knee pain, but you have pain near the knee. So for example, you can have a problem in the muscles and it can send pain towards the knee. So you might think you have knee arthritis, but really it's a muscle problem. So the key is to figure out exactly the cause. You don't have to jump to the conclusion that you need surgery. So let me tell you about a patient I had back in Canada. His name was Leonard, and he was booked to have surgery about 2 months down the road. And I said, Len, don't cancel your surgery, but give me a chance to fix your knee. So we did some treatment, and in about 10 treatments, his pain was gone, and he canceled that surgery. How did I fix it? Well, I fixed the hip, I fixed the ankle, I also worked on the knee. He had tenderness around the knee, so I did my muscle technique. I also worked on the fascia, which is the connective tissue. But the summary is, if you improve function, then pain will drop down. So it's a very rare patient who needs to have a knee replacement. It's a very rare patient that needs to have arthroscopic surgery where they trim the cartilage, for example. So before you go under the knife, do yourself a favor and give the office a call. Just make one more phone call to Dr. Clark, that's my name, and I'm at Dr. Spine Chiropractic Clinic, and I'm at the Indiranagar branch in Bangalore. So give me a call, we'll figure out exactly what's going on, and I'll tell you how I will fix it. So you don't have to have surgery. Okay, one more phone call, Dr. Spine Chiropractic Clinic in Bangalore.